Greetings, and thank you all for joining us today for our 6-month progress report on Partners for a Malaria-Free Zambia, the first awardee of Rotary's Programs of Scale grant. My name is Jenny Andrews, and I am the Executive Director of Malaria Partners International. Today we have participants and guests joining us from many countries on several continents, and on behalf of the Malaria Partners team, I welcome you all. Since you're here today, you probably already know a bit about malaria, which is the greatest killer of humankind in the history of the world. According to the recently released World Health Organization Annual Malaria Report, in 2020, the first year of the COVID pandemic, the incidence of malaria increased from 229 million worldwide in 2019 to 241 million in 2020. Malaria deaths also increased from 409,000 in 2019 to 627,000 in 2020. These sad statistics are due largely to the pandemic lockdowns, which inhibited community-based preventive care, and to supply chain challenges for malaria commodities such as rapid diagnostic tests and malaria medications. Most of the illnesses and deaths from this very preventable and treatable disease occurred in young children and pregnant women, and 94% of those cases and deaths occurred in sub-Saharan Africa, where most of our work takes place. But there is hope, because Rotary is stepping in to change that trajectory. On March 9th, 2021, Rotary International announced the recipient of its first Programs of Scale grant, Partners for a Malaria-Free Zambia. This $6 million collaboration among Rotary, World Vision, and the Gates Foundation is training and equipping and sustaining 2,500 community health workers in Zambia. It's scaling up Rotary's already successful malaria elimination work in Zambia's Copperbelt Province and is projected to reduce malaria incidence by close to 90% in 2 additional Zambian provinces. Malaria Partners International is working closely with all of the partners to continuously assess the needs of the program implementers, convene the partners, and troubleshoot the challenges that we have faced along the way. Slide. With that background, I will shortly turn the program over to today's moderator, Sarah Crawford. But Sarah joined Rotary staff in July 2020 and oversees the Programs of Scale, working across each of Rotary's 7 areas of focus. Prior to joining Rotary, Sarah spent much of her career working in international economic development. Sarah holds an MA in International Communication from American University and a BA in Political Science from the University of Illinois. Sarah comes by her Rotary roots naturally, as both of her parents are Rotarians. Sarah was also a Rotary ambassadorial scholar to Brazil, where she learned Portuguese, attempted to master the samba, and enjoyed interacting with Rotarians. Sarah, thanks so much for joining us today, and I'll turn the program over to you.
Great. Good day, all. Thank you, Jenny. It's wonderful to be with you all to discuss the 2021 results for Partners for a Malaria-Free Zambia. This program will continue over the next 3 years, but today we get to see what the team has accomplished and learned to date. We're going to hear from 4 key players in Rotary's first Programs of Scale Award. First, our esteemed trustee, Dean Rohrers, will share the goals and vision of Rotary's Programs of Scale. Bill Feld will walk us through how we got to where we are today. Martha Lungu will share more on the structure of the Partners for a Malaria-Free Zambia. And Eric Liswaniso will share current metrics on the program. Each panelist will make a brief presentation, after which we will have time for questions and answers. As you listen, please do use the chat feature to submit your questions. So let's kick off with a little background on each of our panelists. Padrine Dean Roars has had a varied career from the early days of being an operating room nurse on Professor Christian Bernard's first heart transplant team to running a nursery school in Malawi. Together with her husband Rhino, they now own or manage a company that's involved in soil stabilization during road construction. Currently an esteemed member of the Rotary Foundation trustees, Dean has been a Rotarian since 1989. She served as RI Vice President, Director, Rotary Coordinator, Regional Rotary Foundation Coordinator, and District Governor. Her most memorable Rotary experience is leading teams of Rotarians and Rotaractors and Interactors to South Africa and seeing how this volunteer experience changed their lives. Bill Feld has been a Rotarian for 33 years. The last 22 have been with the Rotary Club of Federal Way, Washington. He served as the primary international sponsor on 9 Rotary grants, including 4 in Zambia, 3 in Bolivia, and 1 each in Namibia and Nicaragua, traveling frequently to program sites around the world. Bill is currently the lead Rotarian in Rotary's first program of scale, Partners for a Malaria-Free Zambia, and has also served as District 5030 International Service Chair and has been active with Malaria Partners International since 2010. Bill graduated from Carleton College, where he also served for 16 years on its Board of Trustees and as president of Carleton's Alumni Association. Bill received his MBA from Harvard University and served with the United States Foreign Service with postings in Germany, Iran, and the State Department in Washington, D.C. Martha Lungu is Executive Director of Malaria Partners Zambia. She's a past Assistant Governor for District 9210 and a member of the Rotary Club of Ndola. Martha has been a Rotarian for over 15 years. She's a chartered accountant and serves on the Rotary Foundation's cadre of technical advisors in auditing. Martha's dedication and drive to the fight against malaria is seen and heard daily on a daily basis as she represents this program in communities and to the national government in Zambia. Eric Liswaniso is the program manager of Malaria Partners Zambia. He's a service-oriented person that has spent 10 years in the public sector before joining Malaria Partners Zambia in March 2021 as program manager. He is also a Rotaractor turned Rotarian who's motivated to bring the next generation of voices to the forefront in this fight against this deadly disease. Now it's my pleasure to call on Dean to hear a little bit more about Rotary's vision for programs of scale.
Thank you, Sarah, and good day, everybody. What a pleasure and an honor it is to be sharing this time with you all. I come to you from Vancouver, British Columbia, where it's snowing outside my window at this moment, so perhaps we're in for a white Christmas. But now back to our presentation. As we continue to support this incredible work that the Rotarians do, we also want to find new ways to fulfill our mission to learn together and to demonstrate the power of Rotary to create this positive change. Programs of Scale was created to provide Rotarians with long-term resources to implement these larger scale, high-impact programs in all our areas of focus. So together, we seek to increase our impact by measuring our progress and sharing the lessons generated by our programs, and we have a better understanding of how we make this impact throughout our Rotary world. Each year, the Rotary Foundation awards one $2 million grant to a program sponsored by a Rotary Club or a district, working in strong collaboration with partners. These programs have to be evidence-based interventions, which means that these are proven programs that have already demonstrated success in affecting change. Building upon the evidence of success, the programs that we support must be locally relevant. A program can demonstrate this by showing how beneficiaries actually adopt and sustain the change. Now, I know it sounds simple, but this is one of the most critical factors for this program's success. A program also demonstrates that it's ready to grow by having the right stakeholders engaged. And you need to ask the right questions. Who are your champions? Who will make sure that the work gets done? And who will need to take over the program once this grant ends? A program must be implemented according to a strong theory of change, meaning that the activities and investments are designed with results in mind. And we will be tracking those results through strong monitoring and evaluation systems like the one that we are here to discuss today. The results of a program mean nothing unless we have the data to support that. And we are being very, very strong in making sure that we have everything we need to show how, what, when, and why of this particular program. The project needs to be guided by members in partnership with others, leveraging the unique strengths of Rotary. And of course, we are looking at strong financial stewardship, but we are also looking at how our members, especially locally, are using the trust that they have built and how they use their voices for positive long-term change. Very important not only to be seen, but also to be heard. As a trustee of the Rotary Foundation and a member of the Programs of Scale Selection Committee, I can confirm that the goals of Programs of Scale are fulfilled by identifying the programs that are ready for the next step and that represent the best of Rotary. But also, they could be ready to grow further post-grant. I'd like to relate each of these criteria back to the Partners for a Malaria-Free Zambia as the first awardee. First, the program is evidence-based. The program was built on more than a decade of relationships building and learning of what works globally and particularly what works in Zambia. The team here also has a very, very strong vision for the future and is committed to the larger goal of malaria elimination and will continue learning the best way to drive case rates down and improve the health systems for all. Having lived in Zambia, having lived in Malawi, I know this. Malaria is personal for all Zambians. Think on these statistics. Globally, 220 million got infected and 409,000 people died in 2019. Of this, 2/3 were children under 5 years of age and 95% were from sub-Saharan Africa. But to truly make the solutions to eliminate malaria locally relevant, this team is working within local systems to strengthen and roll out already endorsed policy. These members are working in a way to make sure that the full investment and the results that we seek are sustained far, far beyond the terms of this grant. What is critical to this being a Rotary program is that beyond the good stewardship that we expect of all our grants, we see the works that Partners for a Malaria-Free Zambia are doing to mobilize Rotarians and Rotaractors in their communities to make a positive change. And the action doesn't stop there. Rotary members are on national policy councils, bringing their experience and voices to the local planning effort to eliminate malaria. They are being seen and they are being heard. These programs must generate learning for our members, even if they're not directly participating in the implementation. and they must also inspire others. And so we want to share the program logic that will allow for this impact. I also note that today's session is a testament to the commitment to learning and sharing with others. I thank you all for this effort and your transparency, and I look forward to future sessions where we can further discuss the outcomes of this program.
Okay, all right. Okay, I'm happy to be here. I'm in Mpika currently. That's one of the districts in the Muchinga province where we are implementing this project. I think I'll talk about one of the requirements for the programs of scale, which Dean earlier alluded to, and that was that the program was supposed to be ready to grow. And I want to mention that I think we hit the jackpot on this one because we managed to bring stakeholders that came and brought on board most of the resources that were required for the project. If you look at the Rotary Foundation had only committed $2 million, but then the Bill and Melinda Gates Foundation came in with another $2 million, as well as the World Vision USA team. We also being supported technically by PATH and the National Malaria Elimination Center, and also we're working hand in hand with the civic, traditional, as well as the faith leaders. We cannot overemphasize the support we receive from the provincial as well as the district health officers, as well as the members of these communities where we're implementing the project. I think we heard that this project is supposed to be guided by Rotary members. If you look at the kind of collaborations we've received from the Rotary clubs, so in the implementing of the Partners for Malaria-Free Zambia, we look at the structure, the implementing structure, starting with a steering committee. So at the helm of this program, we have the chairperson for the steering committee, who happens to be Bill Felt from the Rotary Club of Federal Way. And by the way, the Rotary Club of Federal Way were the awardees of the programs of scale and dubbed Partners for Malaria-Free Zambia. And working hand in hand with the steering committee is the Project Management Planning Committee, which is a PMC in short. And I chair this committee. It's a 5-member committee. We have 3 senior personnel from World Vision. And our project manager, Eric Liswaniso, sits on the committee as well. So if we look at the Rotary clubs that are supporting this cause, I know in this slide, there are Rotary clubs that are also supporting us on the Copperbelt projects that we implemented, I think 2 years ago. And we also implemented some projects last year, and we're currently working on the training and equipping of 1,055 community health workers. So we look at the Rotary clubs that we are currently working with on the programs of scale. And these are Rotary Club of Nkwazi, the Rotary Club of Lusaka, the Rotary Club of Lusaka, the Rotary Club of Mansa, the Rotary Club of Undola, as well as the Rotary Club of Undola Kafubi. We also have the Rotary Club of Mansa supporting the programs of scale. Okay, I think the next slide basically will show you the implementation of the programs of scale. That was, I think we actually launched the programs of scale in Zambia on the 9th of March. And the actual ceremony was around 27th of March in Lusaka at Protea Hotel. And I think it was well attended, preceded with a startup workshop where all the partners, implementing partners, participated.
Thank you, Martha. And I believe Eric is going to talk a little bit more about now the results to date, and the results to date cover the 2021 calendar year implementation.
Thank you, Sarah. I will dive right in and talk about the operational side of the project. I will also highlight exactly what we are doing on this project. I will give updates on what we have done so far, and I will also highlight some of the things that we are yet to do, but that we are certainly going to do on this project. So what is the Partners for a Malaria-Free Zambia? A lot has already been said about this, but I will just summarize and state that the Partners for a Malaria-Free Zambia is a $6 million Rotary-led initiative to significantly reduce malaria in 10 high-burden districts of Central and Muchinga provinces. The Partners for a Malaria-Free Zambia also aims to strengthen the country's health system by working with Zambian health officials at all levels. Our approach also includes the training of more than 380 health facility staff who are then equipped to supervise the 2,500 community health workers that are the main or the core target of this intervention. What will our intervention achieve? Once we have trained 2,000 community health workers to bring primary health care closer to communities in Zambia, what the ultimate goal is for our community health workers to be able to diagnose and to treat malaria at community level. As most people in Zambia have to travel long distances to access health care, what we are doing is we are training community health workers who come from right within the communities to be able to deliver health care to members of their own communities. At the end of the day, we would have brought primary health care to more than 1.3 million Zambians in the 10, some of the most high burden districts in the country. So what exactly do we do? As earlier indicated, we support the training of community health workers to test and treat malaria at community level. We also equip the community health workers that we train with a healthcare kit. So the healthcare kit is a complete mini hospital, as I would call it, which comes with a bicycle, which in a rural setup would serve as an ambulance, for lack of a better term, in the event that you have a case that is critical and needs to be referred to the health facility. We provide bicycles for the community health workers. We provide them with PPE for their safety. We provide them with a mobile phone, a smartphone, a smart Android phone, which they then use to report cases of malaria. And that makes it easy for the program to track progress in the fight to eliminate malaria in the areas where we are working. We work with Rotarians during our trainings. We are a Rotary-led organization. Every member of staff is a Rotarian, and we work with other Rotarians. And Martha shared a slide highlighting some of the Rotary clubs that we have worked with within and outside Zambia. So every time we are out in the field carrying out our activities, we are accompanied by Rotarians who volunteer on the program. And I am glad to report that so far, to date, in the last 6 months, we've had Rotarians spending more than 2,000 hours of their time on this program. Furthermore, we sensitize communities about malaria prevention and treatment. Let me now talk about some of our achievements to date. We started implementing in March 2021, and we kicked it off with a TOT, a trainer of trainers for facilitators in ICCM, where we trained a total of about 60 facilitators, both in Central and Muchinga provinces. We have also trained facilitators in the new NHC guidelines from the province and at district level, who are then equipped to further drill down to the facility level and train and orient facility level staff. And two, we have oriented the grassroots. We also core community leaders to be sensitized about our interventions in order to promote buy-in into what we are doing at community level. We set ourselves a target of 1,300 community health workers to be trained in year one. I am happy to report that we have exceeded the target by 8, and so 1,308 community health workers have so far been trained, fully equipped, and are out in the field working. I alluded to the orientation of facility level staff in UNHC guidelines, and we have already done that. What now remains is for us to target the neighborhood health committees themselves, which are the grassroots level providers of healthcare in the community. And so what we are doing is now we are drilling down to the grassroots level and orienting the neighborhood health committees in the new guidelines as provided for by the government of the Republic of Zambia. We will conduct drama performances in the target districts as a way of promoting social behavioral change in the communities where we are working. We have already undertaken 3 radio appearances. I think our latest radio interview will air tomorrow on ZNBC Radio 2. And we continue doing this because we find that radio is the best way to reach the communities wherein we operate. We intend to undertake quarterly data review meetings, but data review meetings hinge upon community health workers that have been trained reporting in the system. And so because the community health workers have just recently been deployed, these data review meetings will be conducted at the start of the coming year. So our intervention to date has not been without its challenges. The pandemic has not spared us. The COVID-19 pandemic is a global pandemic, and Zambia has not been spared. And we did encounter a number of challenges, but nothing that I would say is insurmountable. For instance, at the planning stage of this project, we intended to have at least 40 participants per training session. Due to COVID, and for us to adhere to government guidelines on the COVID-19 pandemic, we have had to adjust our class size to 30 in line with the government guidelines as I've indicated. This imposes a cost on the project as we have to now conduct several more training sessions than we would initially have had to. Not only this, sometime during the middle of the year, I believe it's around June to July, we were forced to suspend our integrated community case management trainings following a government-imposed partial lockdown at the height of the pandemic. We like to emphasize that in as much as COVID is real and the death toll from the pandemic is huge and measures have to be taken to protect the public, malaria is equally a killer disease and kills so many more people than the COVID pandemic does. And so we negotiated and we were able to get a waiver allowing us to continue to conduct our training so that the community health workers can go back to the communities and continue to administer treatment for those affected by and those suffering from malaria. And so what we do now is before every training session, we test the community health workers that are participating in our trainings. We ensure that we adhere to COVID guidelines during trainings, and at the same time, we offer the option of vaccination to those that are willing. We did not initially plan to procure COVID PPE, but now that COVID is here, we have to protect our community health workers, and that also imposed an additional cost upon our community health workers. We have also encountered some significant delays in the delivery of some of our critical enablers because of COVID-related challenges along the supply chain. This is just an extract from DHIS2, which is the system that we are using for reporting and tracking malaria in the areas where we are working. It's a very powerful tool and has significantly helped us. Just another screenshot from DHIS, from Tableau and DHIS2. The two systems speak to each other. The black dots that you see in the picture are depicting the presence of community health workers in the areas where we have worked. I did mention that we are working in Central Province and Muchinga Province. And so where you see a black dot, it is indicative of the presence of community health workers. So far, we have trained about half of our target of 2,500. And once we are done with the balance, we expect that whole region to turn black, meaning we would have saturated the entire the entire 10 districts where we are working in. The last picture that I'm going to share is just a depiction of the commodity situation. The system that we are using, DHIS2, is able to show the level of commodities. By commodities, I mean malaria drugs and malaria test kits that the community health worker has at the facility. So from the system, you're able to track whether the community health worker is equipped with drugs or the community health worker is lacking drugs. And I believe my presentation ends here, Sarah.
Yes, thank you. I believe Bill will wrap us up and then we can move into some questions.
I just wanted to make certain everybody is aware that this partnership did not just come together for the programs of scale. Rotarians have been working together, U.S. Rotarians and Zambian Rotarians have been working together since 2009. This has been a great partnership. We also, we were guided toward malaria and Zambia by the Bill and Melinda Gates Foundation's former chair, that was Bill Gates Sr. So they have been aware of us and our activities really since 2009. And at the very inception, we began talking with the National Malaria Elimination Center and the Global Health Organization, PATH-MASEPA, which has been active in Zambia for many, many years. And additionally, we Rotarians have worked for a number of years with World Vision on not just health projects, but also water and sanitation. And I think that cooperation goes back at least 15 years. I can tell you that from the Rotary Club of Federal Way, who's, and we meet 3 kilometers from where World Vision has its U.S. headquarters. So we have known World Vision. We've had members of our club who have been employees of World Vision, and our club has done projects with World Vision. So all of the partners that we are now working with on for this program of scale have been long-term partners. This is not just a transitory thing. This is has been a commitment for many, many years, and I think that allows us to work very well together, and I think that brought some credibility perhaps to Rotary International when we made our application. So we have great funding partners and we have great implementing partners. And of course, the Rotarians in Zambia are just doing a fantastic job, including the volunteers. So we're just delighted at our progress. We are hoping, frankly, to build on this. And I think the funding partners are eager to expand our commitment in Zambia and expand our commitment in sub-Saharan Africa. So we prove if we really implement the get proof of concept fully, we expect to have support from the funding partners and expand this to a really large sub-Saharan Africa commitment.
Great, thank you, Bill. Thank you all. I have had the pleasure of directly working with this team for many months now, but I always hear something new each time we talk, and I'm impressed with the level of dedication and focus on results. And the result is malaria elimination here. So Bill, let's just go ahead and kick into one of the main goals of Programs of Scale is to lift up lessons learned of successful programming and provide advice to others across the Rotary world. For those who are interested in malaria programming in particular, what have you learned through this program that you'd like to share with others?
Well, I think one of the most important things is you have a very capable local infrastructure. And by that, I mean that we have the National Malaria Elimination Center has helped and guided, as with PATHMA SEPA, has guided thousands of trained thousands of community health workers. So we have a curriculum in integrated community case management, which is very thorough, not only with malaria detection, but also they learn about diarrhea and lung diseases, which are often associated with those who get malaria. So you have to have really terrific local support, and obviously the government support of any program of scale is an absolute must. And then Rotarians, as I said, we have worked with the Zambian Rotarians for over a decade, and they have been terrific. And you can see from Martha and Eric that their level of dedication is extremely high. The partners have to be strong, and Rotarians have to be dedicated, and indeed they are.
Eric, you really shared a lot of data and some impressive dashboards that you are contributing to. So can you tell us again, you talked about cell phones with the community health workers. How is this data generated? How are you tracking the quality of this data? How are you sharing this data with your partners and others who are committed to eliminating malaria in Zambia, so that you know that this program is actually contributing to a reduction in malaria, severe disease, and death?
Thank you very much, Sarah. The dashboard that I earlier alluded to, I'm just going to explain how it works. I did indicate that we provide the community health workers with smartphones, Android phones that they use for reporting. So what we do is during training, we also equip the build the capacity of the community health workers to report using these gadgets. So when they get back into the community and as they are working, they are then able to feed the data or into the DHIS, which is District Health Information Systems, a malaria-centric tool that all the partners working on malaria feed into. So from a central level, we are able to inspect DHIS2, and we are able to see from those dashboards that you saw that community health worker X or community health worker Y attended to 10 patients and was able to treat 5 of those and maybe referred 2 of those. All that can be tracked through that very beautiful and elaborate system. So DHIS2 is basically like raw data, but DHIS2 feeds into another system called Tableau, and you are then able to extract those results in the beautiful graphics that you saw in Tableau, and it's a more picturesque presentation of the data and much easier to understand even for the lay person. This information, like I said, this is a central system, and every partner working on malaria is able to access the system, and we're able to track the progress that we are making in the areas where we are working, and we're also able to see what other people are doing in the same space and exchange notes, and because we are all working towards a common goal. I should hasten to mention that anybody with login credentials to DHIS2 or Tableau is able to access the system from wherever they are in the world. So Bill is able to look into DHIS2 and see how the community health workers in Muchinga are performing from the comfort of his house in Seattle. And I am able to do the same from Undola. So that's how we track the progress. And we have periodic meetings with other partners on the implementing similar malaria interventions. And together we are able to pick each other's minds on how best we can improve in areas where we need improvement and yeah, share best practices.
Great.
Thank you.
Great. And Trustee Roars, why is this information why is this tracking of data and sharing of measurements so important to Rotary and the Rotary Foundation?
Thank you for the question, Sarah. And yes, it's critical. It's really critical for us to understand exactly what has happened, how it's happened, and why it's happened. And we really, really need to be able to measure our successes. But, first of all, I know that our members are already making such a positive change every single day. And we do this in a way that really makes sense to the identity of our clubs and our districts, as well as to the local priorities and the needs of where we live. But with that said, as an organization, we want to get even better, to do a better job at being able to understand both the results that we are generating around the world, but also we need to understand exactly what impact our programs and our projects have. And we do this through our grant portfolio, our programs, and also the work that we do within our communities. Why is it important? It's important because we need to look at our resources and we need to plan for the future. But it's also critical for us to be able to tell our story, because this actually attracts the next generation of members to this amazing organization of ours. Look, we all know what we've been able to accomplish in the fight against polio. But now we have the start of a new story, the story of malaria. And what better way to tell that story across the Rotary portfolio than to be able to substantiate what we have done with data and the reality, the facts and the figures. We also need to know what we did that was successful. What were the challenges and how we overcame them? All that this can do is to strengthen not only our grant programs, but our whole portfolio across the Rotary Foundation. There are many lessons to be learned. And I think the way we learn these lessons is through tracking exactly what is being done. So Sarah, in my mind, this is critical. It is really, really the essence of the final results of the program.
Great. Thank you. I know that there are many other questions. Ariel, how are we doing on receiving questions from the audience? Do we want to start bringing some in now? Otherwise, I definitely have more for the group.
Thanks, Sarah. We do have a question on if there's plans to integrate the effective malaria vaccination, which will be available probably in the near future into this project.
Great. Martha or Bill, maybe you can talk about, I know we've had many conversations about it at partner meetings, but talk about the amazing news of the availability of malaria vaccination or approval of malaria vaccination and what it means for this program.
Thank you, Sarah. I know it's good news. Any news that promises the elimination of malaria is welcome news. But I think let me hasten to mention the fact that even if the vaccine is introduced and implemented in Zambia, we I think it will cater for the under 5, if I'm not mistaken. But I know we still have malaria cases still going up, as earlier mentioned in the presentation by Jenny. And going forward, we still want this program to succeed and to go on. And I think if that vaccine was introduced, my take to it will be that the community health workers that we are deploying will be a great resource to use for vaccinating these under 5 children in these areas where they are located. But I think it's good, although it's good news, I doubt it's being implemented now in Zambia, because I think it still has those challenges they need to work on. Yeah, but I think it's a good move. Thank you.
Thank you. Ariel, anything else from the audience?
Yes, we have a question. If you eliminate malaria in one village and not in the neighboring village, how much do the anopheles move around and come back to that village? How much do people know about the transmission of, average people know about the transmission of malaria?
Yeah, I think Martha, Bill, or Eric would be well positioned to talk about reactive and cases and also awareness.
Thank you very much. I will attempt to tackle that. So let me start by addressing the last question, which is how much do people understand about malaria transmission through the female Anopheles mosquito? From my experience working in Muchinga over the last 6 months, I would say very little. Many people still believe that the malaria parasite is carried by the mosquito, which is partially true. It is carried by the mosquito, but the mosquito is a very innocent carrier. These parasites are transmitted from human to human. And so that's information that we need to get to the public first and foremost. And that's why we have all these interventions talking about community sensitization. Once we have sensitized the public and people understand that these parasites are being transmitted from person to person, brings me to the other question, the question of if you eliminate it in one village and it's not eliminated in another village, how far do the mosquitoes travel? Which I have to say is a very brilliant question. The longest distance a mosquito carrying the parasite after it has beat a carrier of the parasite, the longest distance it can travel is 140 meters. And so what we do, part of the ICCM model, which is integrated community case management, we have what we call reactive case management, where if we find that there is a malaria case in a household, we immediately move in through the community health workers that we have trained to test everybody around that person within a 140-meter radius to ensure that the spread of the parasite is limited. And what we find more often than not is that around the person that has malaria, there's usually other people that are now carrying the parasite from that person, but are probably asymptomatic, much like is the case with COVID. And so we are sensitizing communities to say, look, you could be asymptomatic, but you are carrying the parasite. And so we conduct this reactive case management where we go to the source of the problem and we test everybody around that community. And if our intervention is effective, which it is, and it has been proven by the World Health Organization to be a very effective intervention, then we shouldn't have cases where we have malaria in one village and we still have it in the other village, because what we are doing is we are saturating across the district. If we say the need for Kanchivia is 217 community health workers, we train and we deploy 217 community health workers, and each one of these community health workers catered for a population of no less than 500. So once a district is saturated and the community health workers fully equipped, then we have eliminated malaria from all the surrounding villages in that locality. Thank you, Sarah.
Great. Yeah, I think that's one of the really interesting parts of this program is it looks like a training program and bicycle delivery program, but really it's a sensitization program and making sure all the right people with the right information are in the right places with the right tools, and being promoted throughout the national health system. With that, I'm sure there are other questions. I'm sure that the Malaria Partners International team would be more than willing to take your questions moving forward. And also for those of you interested in learning more about programs of scale in general, the hub for that information is on the Rotary website, which Jenny and Ariel can share with everyone at the end of this presentation. But I do want to pass it back to Jenny to do the wrap up today.
Thank you, Sarah. I appreciate that. We are now, unfortunately, at time, so I want to thank you, Sarah, for being our moderator, and thank you to all of our speakers, Dean, Bill, Martha, Eric, and all of our listeners for joining us today. As Sarah mentioned, a recording of this webinar will be available on the Malaria Partners International website. And if you would like to have one of our board members speak to your Rotary Club or any civic group, we would be delighted to do that. So please reach out. Our information, or our website, also contains information about how to request a speaker. So thank you all. We hope you will join us in the fight for a malaria-free world.